I'm Dr. Karthik, consultant neurologist from Rajahmundry. Today I am going to give a small information about what the patient and the caregiver can give for the doctor during epilepsy diagnosis. So the diagnosis of epilepsy is made by taking into account multiple factors. First and foremost, the most important thing will be the history of the seizure. That is the semiology, how the patient presented, to give the history of the patient, how the patient presented. So what was the patient during the episode was doing? That is, was the patient asleep, or the patient is sleeping, or the patient is doing some other work, or the patient is doing any argument or other things. And was it associated, how was it associated with any factors that like ictal, fright, fall, or any injury, or if the patient is having any staring looks. These needs to be observed by the attender, as the patient, they themselves cannot be able to give the information. So need to be observant regarding the how the seizure started. Was it started with a single arm, or was it started with the staring, or if the patient had all limbs involved, or if there is any stiffening of the limbs. So depending on these things, we can diagnose if it is focal seizure or generalized seizure, chronic seizure, or absent seizure, or the myoclonic jerking is present or not, as it comes in the myoclonic seizure. So depending on the type of semiology and depending on the type of presentation, these seizure types can be differentiated, which aid in the diagnosis of the seizure type. Video recording of the event should be done by the attender. So things which we take into account during the diagnosis of the seizure will be associated factors. Was the seizure associated with any previous history of trauma, or if the seizure was associated with any history of fever or altered behavior, which comes under neuroinfections. And also, most importantly, the genetic factors, and genetic factors will be also taken into account by the family history given by the patient, attendants, and the close relatives of the patient. So these factors, if they can be given, is of very valuable in diagnosis of the seizure type and treatment. So the other imaging modalities like MRI and EEG will aid in the diagnosis of the seizure. So all these factors needs to be taken into consideration before diagnosing the epilepsy type.